But are monkeys really the primary transmitters of monkeypox? As the resurgence of monkeypox continues its global surge, the World Health Organization on Saturday, the 22nd day of May 2022, said that 92 confirmed cases of monkeypox have been reported across 12 countries, while 28 suspected cases are under investigation. The cases have been reported in Australia, Belgium, Canada, France, Germany, Italy, Netherlands, Portugal, Spain, Sweden, the United Kingdom, and the United States of America. Nigeria has not been spared by the prevalence of the disease, as the Nigeria Center for Disease Control reveals that 21 confirmed cases and 1 death have been reported from 9 states and the FCT. Dr. Suleiman Ladan is a senior veterinary officer of the Federal Ministry of Agriculture and Rural Development. He doubles as a federal epidemiologist. He tells us more.
So far here in Nigeria, I can tell you there are from 2021 to date, 66 cases has been reported, including 1 died of it. I know it was reported in Abuja, it was reported in Manchok, Jos area. Recently, we had a case of an outbreak in Adamawa prisons, in Port Harcourt, like in Bayelsa, like in Delta, like in Ondo, Lagos, and etc.
According to the World Health Organization, monkeypox is a rare viral zoonotic infectious disease transmitted from wild animals to humans and is endemic in areas in and around tropical rainforests in Central and West Africa. Is the disease prevalent in Sokoto State, Nigeria? Dr. Ladan takes us a notch further.
In Sokoto, Kebbi, Zamfara, or other parts of this northwest, no cases has been reported so far. So I can't specifically tell you that it is entirely absent, but no case has been reported so far.
Are monkeys really the primary transmitters of the virus?
They just discovered them in monkeys, but monkeys are also victims. They are not the reservoirs. In most of the literature that you can find out, actually, African giant rat, popularly known as burgu in Hausa, rodent, squirrels, kurege in Hausa, is mostly incriminated. The specific reservoir is not yet been established worldwide. So, but these particular animals that are suspected primarily to be the reservoirs of this particular virus.
What symptoms can possibly be attributed to monkeypox?
It starts with a fever, headache, muscle aches, exertions, and rashes all over the body, mostly on the feet, on the flanks, on the genital organ, that is the private part, in some cases.
But how does one differentiate monkeypox from chickenpox?
It is very difficult for a layman to try to establish differences between various diseases based on symptoms or based on presentation. Sometimes A will look like B and B will look like A clinically. So you cannot just come out and say this is monkeypox by bare seeing or by mere seeing, because even clinically it may be confusing unless when you go to the lab and test the possibility of antibodies or whatever parameters one may want to use to differentiate this particular disease.
Although experts say monkeypox can be transmitted from animals to humans, but can humans also transmit the disease to other humans? The epidemiologist tells us more.
People come in contact with this particular diseases, maybe particularly those that normally take wild bushmeat, or people that come in contact with those that are already infected with the disease, that is human-to-human transmission. It can be transmitted through sexual contact, although it has not been yet established whether it is found in the fluid or the semen, seminal vesicles, or things like that. It has been established.
Let's find out the risk factors of the disease.
Yes, the risk factors actually primarily are those people that are handling the wild animal, and those that go after the bushmeat are at higher risk compared to people that doesn't mingle with this particular bush animal. Those that stays in the zoo, those that work in the zoo, those that handle wild animal for research purposes, those are the primary risk. And the clinician, of course.
But how do you diagnose monkeypox? Will suspected patients be quarantined during treatment like the case of COVID-19?
It's not a death sentence. Once somebody is infected, he should just take himself to the clinic. It's not like a COVID-19 that it might require that you have to go to an isolation center because of the nature of the transmission. Somebody that is infected with a monkeypox does not require to go on isolation center. It can just be kept in a certain ward and be treated.
Dr. Ladan, however, gives us tips on preventive measures.
But the best thing, once someone has established that he has seen the symptoms of rashes, the best thing is try to take himself to the clinic to make sure he's given due clinical care.
With the number of monkeypox cases on the rise in Nigeria, one would wonder just how prepared is Nigeria to respond to this outbreak.
The Nigerian Center for Disease Control, in collaboration with Federal Ministry of Agriculture, has a team that where the outbreak was reported, a rapid response team was raised to now go and launch an investigation, contact tracing to see how they try to establish where this disease was trying to emanate.
Based on reports of preliminary risk assessment done by a group of subject matter experts from the Nigeria Center for Disease Control, relevant government ministries, departments and agencies and partner agencies has revealed that on the 26th of May 2022, the Nigeria Center for Disease Control and Prevention activated a national multi-sectoral emergency operations center for monkeypox at level 2 to strengthen and coordinate ongoing response activities in the country while contributing to the global response. Naomi Kongbenda reporting.